If you're like me, you use social media to follow dog accounts because the dogs are all very good boys. But if you surf the dark corners of the internet where people with no medical training dole out medical advice without any qualifications, then you may have heard someone talk about heavy metals. And no, I don't mean the music. Heavy metals, things like mercury, lead, arsenic, iron, supposedly cause everything from heart disease to autism. Now, you might be saying to yourself, wait a second, lead poisoning isn't good for you. I learned that in medical school. And you would be right. But the problem here is that people are using this factoid to push chelation therapy on an unsuspecting public. Now, if you don't know, chelation therapy is a medical procedure where you remove heavy metals from the body, obviously useful in cases of acute lead poisoning, for example. But it isn't going to cure autism, and it's certainly not going to reduce your cardiovascular risk. Except, about a decade ago, the TACT trial suggested that it did. Now, there were problems with this study, a high dropout rate, maybe blinding failed, and lots of interim analyses. To make a long story short, even with all these caveats, the benefit was mainly limited to diabetics, so a confirmatory follow-up study was planned. TACT 2 was supposed to settle this issue definitively, and it was negative. So if someone tries to sell you chelation therapy, don't buy it. It doesn't prevent heart disease, it doesn't treat autism, and it's potentially dangerous. It took over a decade and how many millions of dollars for us to figure it out, but at least it's done now. For Medscape, I'm Dr. Christopher Labos.